Hey there, friends. Got some important news to share about changes in the Medicare Advantage world that might affect you or someone you love. I'm diving into this because I genuinely care about making sure you have the information you need to navigate your healthcare options with confidence. So let's have a nice, calm conversation about what's going on with UnitedHealthcare and some Medicare Advantage plan commissions. Recently, UnitedHealthcare announced they're cutting broker commissions for new enrollments in a small number of their Medicare Advantage plans and over 100 plans across more than 20 states starting July 1, 2025. And the question that you're probably asking yourself now is, Kevin, what does this mean for you or me? Well, commissions are what pay licensed agents who help folks like you pick the right plan. And if agents aren't getting paid for certain plans, it might make it harder to get personalized, unbiased advice about those options. And trust me, folks, choosing a Medicare plan can feel like solving a puzzle based on how many thousands of options there are out there and from conversations I've had with seniors just like you. So having a trusted guide is key. So here's the deal, folks. UnitedHealthcare says they're doing this to manage rising costs, and they'll still pay commissions for members enrolled before July 1. But what about the new enrollments in these plans? What happens for them? Well, it's pretty simple, pretty easy. They'll get no commissions. Other big names like Aetna and Cigna are making similar moves, which has folks in the industry worried. Groups like the National Association of Benefits and Insurance Professionals are saying this could limit your access to agents who take the time to explain plan details, compare options, and make sure you're getting what's best for you. And I don't know about you, but I think you deserve someone in your corner to help with those decisions. Now, I'm not here to scare you, just to keep you informed. Medicare Advantage plans are still a great option for many, but changes like this remind us how important it is to work with professionals who put your needs first and not the insurance companies or their own commissions. That's where my friends at Chapter come in. They're a team of trained, licensed professionals who are all about giving you honest, unbiased answers about Medicare, no strings attached. And whether you're curious about plan changes, wondering what these commissions cuts mean, or just want to make sure you're in the right plan, they've got your back. And the best part is you can call Chapter for free anytime at 270-467-2426. They're not here to sell you something. They're here to help you understand your options so you can make the choice that's right for you. I love that they focus on what's in your best interest, and I know you'll feel supported when you chat with them. So if you're feeling a little overwhelmed by all this Medicare talk, don't worry. You don't have to figure it out alone. Give Chapter a call at 270-467-2426 and let them guide you through the process with a friendly, no-pressure conversation. I'm here to keep you all in the loop, and I'll always share updates to help you stay on top of your healthcare game. So stay well, and let's keep looking out for each other, folks. And like I shared with you yesterday, Stephanie Brown saved $1,488 after her free phone call to Chapter. Charlie says Chapter does everything for you, including making the switch with Social Security. Nightmare averted. Palmer said, Kevin, I spoke to a Chapter rep on Thursday. I'm in the best plan for me at present. Thanks. And you're very welcome. Thank you for taking advantage of a free resource and calling our friends at Chapter. Marilyn Kaplan says the people at Chapter are really good. Sarah told me she's sharing Chapter with her mom, her mother-in-law, and her family and friends that have Medicare because we need help. And that's great. Please share. Chapter is entirely free, and all they do is help people like you. Longtime subscriber Karen said, Chapter handled my Medicare sign up and it was a breeze. And I could read you hundreds more like these, but the most important will be your own testimonial and sharing how easy Chapter made things, and more importantly, any money savings. Pick up the phone now, call, dial the number on your screen, 270-467 2426. Call Chapter right now, and I bet you'll be glad that you did. Okay, friends, let's talk about your future and some more Medicare and Social Security news you need to know. I've done extensive research for you all, my amazing community here, and I'm reaching out because I care deeply about you and your future. There's some big news about Medicare and Social Security that could impact your retirement, healthcare, and peace of mind. And so what I've done is I've broken it down in a simple and easy way so you know what's coming, who's affected, and how you can get ready. So let's dive in. Number one, what the heck's going on? The latest report from the folks who oversee Medicare and Social Security says their trust funds are running out faster than expected. And the reason being? Rising healthcare costs and a new Social Security law that increased benefits for some folks are putting extra pressure on these programs we all count on. Perhaps the big one everyone's worried about is the Medicare's hospital insurance fund, and it's now projected to run dry by 2033. And previously it was 2036. And now that ticking clock has been pushed up. After that, it could cover only 89% of hospital stays, hospice care, nursing homes, or home health services. The Social Security trust funds are set to hit empty by the year 2034, and that's a year sooner than previous estimates and will be here before you know it. But if that happens, benefits for retirees, disabled folks, and survivors could drop to 81% of what you're expecting. Please listen to me, folks. This isn't about scaring you. It's about making sure you're in the know so you can plan smart and get prepared. So who's going to feel this the most? Well, as you all know, I'm looking out for everybody, each and every one of you. But here's who might feel the biggest impact. If you're 55 years old or older and you're either retired or getting close, a cut to Social Security could shrink your monthly check, and Medicare shortfalls might mean bigger hospital bills. Folks with disabilities, and that's over 8 million of you who rely on Social Security. But a 19% cut could make it harder to cover daily needs. Anyone between the ages of 40 to 54 years old, which includes yours truly, and as we are planning for retirement now, we mustn't ignore the reality of how these changes could hit just as you're ready to relax. And all the low-income folks out there, let me know if this applies to you, and just type your annual income or how much money you make in a year down below in the comments. To see if you're considered low income in the US, check if your household income is below the 2025 federal poverty guidelines, which is about $15,650 for one person or $32,150 for a family of four. Many programs count you as low income up to 200% of that. And so $31,300 for one or $64,300 for four. But if Social Security and Medicare are your main support, any reduction hits may be felt worse and make things extra hard. And so what's the timetable, or essentially, when will this happen? Right now, as early as 2033. And that's when Medicare's hospital fund could start falling short, affecting 68 million people, mostly those 65 years old or older with disabilities. And then the following year, in 2034, is when Social Security benefits could drop for 69 million Americans, including retirees and disabled workers. Okay, folks, let's get real and talk about what this could mean for you. So stick with me here and listen closely. Number one, healthcare costs. If Medicare only covers 89% of hospital bills, you might be stuck paying hundreds or thousands out of pocket for a single stay. Number two, less income. A 19% cut to Social Security could mean losing about $3,800 a year based on today's average benefit of $1,670 a month. That's money for groceries, rent, or prescriptions. And three, uncertainty. Politicians keep delaying fixes, which leaves your future up in the air. And that's not fair to you, but I'll be sure to bring you all the latest as news breaks and updated information is made available. And I'll make sure to break it down and explain it to you in a way that's simple and easy to understand, because The way they write these bills and proposals, you need a PhD or a master's degree to even understand it sometimes. And here's the important part. How can you get ready and prepare? I'm here to help you take control and have compiled a simple list for you guys. So feel free to take notes or come back and watch this video again to make sure you've got it all down. And so here are some practical steps to protect your future. First, try to save a little more. If you can, bump up your 401k, your IRA or HSA contributions. Even $20, $20 a month adds up over time. Next, look at extra insurance. For example, check out Medigap or other Medicare plans to help cover what Medicare might not, and Chapter can help you with that too. Just give them a call and tell them Kevin sent you. Consider building other income, maybe even think about part-time work, investments, or even renting out a room to ease reliance on Social Security. My mom's on Social Security and she started a YouTube channel to help her out. Maybe you could do the same. As always, stay in the loop. Follow groups like AARP for updates on these programs, or just subscribe to my channel. Remember, knowledge is power, and plan for higher costs. Start budgeting for bigger healthcare expenses, especially for hospital or long-term care. And who knows, things may change, but it'll be best to plan for the worst and hope for the best. It's better to have it and not need it than it will be to need it and not have it, right? Leave comments and questions, folks, please. I want to read them all. Tell me, what would losing $3,800 a year mean for your day-to-day life? Could you still enjoy to do the things you love and bring joy to your heart, or cover your meds? Or how about if a hospital stay costs you thousands extra? Are you ready for that? How would that affect your savings, your family, or your retirement? And what kind of retirement do you dream of? Will these changes make it harder to make that dream a reality and come true? Don't forget why this matters to me and you. You've worked hard your whole life paying into Social Security and Medicare with every paycheck. These programs are your safety net, your reward for decades of effort. They're about living with dignity, not worrying if you can afford a doctor's visit or your rent. And with 68 million on Medicare and 69 million on Social Security, this touches almost every family, including yours and mine. And I want you to feel secure, not stressed. Remember, you don't have to face this alone. Let's do this together. Start small. Check your retirement savings, explore insurance options, or call your elected officials to demand action on Social Security and Medicare. Call Chapter and find ways to save money on healthcare. Chapter's there for you no matter what. I'm rooting for you, and I'll keep sharing updates to keep you prepared. You've got this, and I've got your back. We've got your back.